All right. Thank you everyone for logging in and taking the time out of your day to join us today for our next quarterly faith community meeting. We have two guest speakers today. We have Bishop Joey Johnson coming in as well as Nurse Jane Dancy. So we're pretty excited about having them here. They're going to be talking about COVID-19 efforts and grief recovery. And then we also have Carla back with us yet again. I keep recruiting her for all of these meetings to give her little overview. She does a great job. And then we also have Lori Smith coming at the end to speak some more about our health and wellness programs and different hosting opportunities that are available with those. So I will turn it over to those who are here and so kind to speak with us today, starting with Carla.
Good morning. Hopefully everyone can hear me. Sometimes I have some sound issues, but I think we're doing okay right now. I mentioned to Courtney that we had a little blip here of the electric just a few minutes ago. So if I jump away, that's why, but I think we're doing okay right now. So it's so nice to see everybody and I appreciate you coming. It looks like our numbers are growing and I'm very excited about that because I love when we can share what we do with all of what you do. And when we come together, we really help all of the community members that are in need. Our first slide here is very nice. It kind of lets you know who I am. I work with the Aging and Disability Resource Center. We have several parts of the Aging and Disability Resource Center. We have a call center where we take calls from consumers, also called patients, family members, professionals, pastors, anyone that thinks that they would like to get some information on community resources can give us a call. And we also have assessors. We have 18 assessors who go out in the community, depending on how COVID's doing. We go out in the community and we see people face to face and we talk about their long-term care options. We talk about the programs that are eligible for them, or we assist them with obtaining a level of care and the needed paperwork to go to a nursing home. Our PAR unit is also a part of the Aging and Disability Resource Center. So we have three parts which really talk about independent living, assisted living, living in a facility, group home placement, a lot of different things. We get right up in people's business and find out what's happening and how we can help. I do give that warning as I start to talk to people that we just met, but I'm going to ask you a lot of personal questions. That's kind of hard. Our screeners are trained to really talk gently, calmly, look at presenting need. If today we can talk with someone about food, maybe they call us back later about housing. Maybe they call us back later about how to get a power of attorney information. What is a power of attorney? What's a durable medical power of attorney? What's guardianship? What do you need? Our screeners are really good at taking the time, finding out what's going on and how we can help that community member. So it's wonderful. Some of the programs that we have, you've probably heard of the biggest one, which is Passport. It's a Medicaid funded program to provide services to eligible participants in their home, in a home and community-based setting. And that's wonderful because to stay independent in your home, sometimes you just need a bath twice a week, someone to take out the trash, help you pick up your medicines from the pharmacy and do a load of laundry. That little bit of support can keep someone in their home a long time. Or nutritious meals. Sometimes people go down to just eating out of packages because that's what's easy for them and maybe they don't have a support system. You may notice some of those people coming into your church, into your congregation. They maybe were very active and they haven't been coming as much. Maybe you notice that their attire is disheveled. Their hair maybe isn't on point the way they normally keep it. You can feel free to talk with them and just say, hey, there's this company, and if you give them a call, or I can call them for you and they'll call you back. They can talk about ways to help you remain independent in your home, which is our goal. Our goal isn't to come in and take somebody out of their home. We want to offer those supports so that they can stay independent in the place that they call home. That can be their home, their house that they lived in for 40 years, their apartment, a group home, their daughter's home, wherever they call home. we want to give them supports to help them stay there. Maybe assisted living is a better option for them, but everyone knows assisted living is extremely expensive. But Medicaid provides an assisted living waiver to help people pay for assisted living costs in the state of Ohio. In our area, we have many beautiful facilities that are private pay as well as waiver beds. And there's no difference. They don't get a different room. They're not treated any differently. We're here in the Green area and we have several beautiful facilities. St. Ed's has waiver beds that they offer us. Greenview Inn, they have some beautiful, beautiful beds. So they're private pay here mixed in with waiver, and no one knows their payment source. And they get good care 24 hours a day. They get that 24-hour supervision, which is very helpful. So wherever they choose to call home, we want to support them and get them assistance to get there and hopefully get it funded through Medicaid. Many people know what Medicaid is. They understand the difference between Medicare and Medicaid, but they don't realize how many different types of Medicaid there are and what the level is. A lot of people have applied for Medicaid and they say, I was denied, I'm not under the income. There's base Medicaid income, and then there's waiver income. So if they need additional supports to remain independent in their home, they can apply with us for a waiver to help them. It kind of waives that lower income amount and lets them make a little bit more if they qualify. We want to talk with them about that. We want to help them with that because they maybe only make $1,200 a month and they think, well, I got denied when I made $800, they said I had to be under $800. So we don't want them to think that they don't qualify. Let us assist them with the Medicaid application. Let us tell them about the program, and then they get to make a decision. Yes, I want to be part of this, or no. And if they don't, we'll offer them community supports. There may be some great, there's COVID meals out there. There's City of Green Lifeline. There's a lot of community resources. Maybe they want to go that route. So we're willing to help them with that. A lot of other people have issues with Medicaid estate recovery. They're worried that the state's going to take their house. And there is a state recovery for specific types of Medicaid, and we are happy to go over that with them and what that means. Do they take the whole house? Do they take a percentage of the house? Do they take it while I still live there? What if my spouse lives there? I think people would be very surprised to find out that they can remain independent in the community. And if a wife goes in the nursing home and the husband's still in the house, state recovery isn't in effect until after he leaves. So it's not like they're going to rip that property out from underneath of them. So there are some nuances to estate recovery that we can help them understand, or we can just help them with Medicaid application, and then they can listen to what Job and Family Services says. And again, they have the right to make the choice. Apply and then say no thank you, apply and go through it, or don't apply at all. No pressure here. We just want to make sure people remain independent in the community. So there's assisted living, there's Passport, there are some community programs that are grant funded. There's a little bit of money out there for people who don't qualify for Medicaid, yet can't pay for services themselves. They're very expensive. And we assess them for all of those programs in a single visit. So that's why we have so many questions to get all up in their business with each one. Sometimes we get it done in one visit. Sometimes it takes us a little bit of time to develop that relationship. We mail them information once, they call back again about a food program, and then maybe 3 months, 6 months later, they call back about the waiver programs. So we don't always capture everyone the first time, but we want them to know about Direction Home before they need Direction Home, so that they are empowered to make decisions on their care before it's a critical time in the hospital with a broken hip, in the hospital with COVID, any situation that is very emergent. We don't want them making lifelong decisions. So we're here to help them 8 to 5, Monday through Friday. We do assess during those same hours, 8 to 5, but we are more than happy to go out on a weekend or later in the evening if someone has a family member that can't make it during that time. We've got some extended hours that we can do. And a wonderful thing that we just implemented a few weeks ago is an online referral form. Reaching us between 8 to 5 can be difficult. A lot of people work. They can't be on their cell phone. They're just too busy to sit there and give all that information over the phone. So if you go to our DHAD.org website, there's a big button right beside the COVID button that just says, make a referral. And we are happy to gather that information, and then either we'll call you back, we'll call your parishioner back, we'll call your neighbor if you're making a referral for your neighbor, we'll call them directly. There's an open text box there. There's a lot of information about who they are, and you can fill in what you know. If you don't know, you just write unknown. Then there's an open text box. And if you want to tell us a little bit about what's going on, we'll be very sensitive when we give them a call back. You're welcome to call, fax, email, or do a website referral. Any way you get to us, we're just happy that you give us a call and let us have an opportunity to help you share some information and community resources with your parishioners. If anybody has any questions, I'll be here. You can put them in the chat. You can email me directly, I'll have a few minutes just to answer any questions if I can.
Thank you, Carla.
Thank you.
Okay, I am going to turn it over to Nurse Dancy, not Darcy. I have to give credit to our guest speakers today. They've stuck with me through rescheduling from June and then me chronically misspelling Nurse Dancy's name. So thank you. Thank you for coming. And I'll turn it over to you and have you speak to us about COVID-19 efforts.
Okay, great. Thank you so much, Courtney. We appreciate you inviting us to come and share about efforts in the faith community. Again, my name is Jane Dancy. I'm a registered nurse. I attend Mount Calvary Baptist Church, and our senior pastor is Jeffrey Allen Dennis. One of my partners was supposed to be with us today, Nurse June Adams, but she was unable to come. But I would just like to send her regards to everyone and blessings as well. So today I will briefly review some information about COVID-19. Then I will talk about some of the efforts going on or that have gone on in the faith community, and then discuss ways that we can move forward. So in regards to COVID-19, COVID-19 was first identified in Wuhan, China in 2019, the fall of 2019. And since that time, as you all know, we've gone into this pandemic that has lasted 18 months and may last a little bit longer. COVID-19 has been in the communities for many, many years. It can be transmitted from animals to humans. The symptoms includes cough, colds, and transmission is more of with coughing, sneezing, talking, and contact through droplets. In regards to prevention, we all know the prevention measures: to wash your hands, to social distance, to use hand sanitizer as well. And in addition to that, to get vaccinated if at all possible. Approximately half of the population has been vaccinated against COVID-19, but in some zip codes, that rate is 1/3 of the population has been vaccinated, especially in the southern states. And then in Summit County, some of our zip codes have also only 1/3 of the population been vaccinated. In the United States, we've had approximately 43 million people infected with COVID-19, and 680,000 souls have been lost from COVID-19. So the next slide, please. So we all know the signs and symptoms. I'm not going to go over all the signs and symptoms. So we know all of those signs and symptoms: loss of taste and smell, cough, congestion, fever, chills, all of those areas of infection from COVID-19. So those are the signs and symptoms. And as you know, we do have the Delta variant, which is a new variant in the community. And so with that new variant, those symptoms start early. And I will talk a little bit later about that. Socioeconomic impact of COVID-19. COVID-19 has revealed the disproportionately effects of socioeconomic issues in the African-American communities and other communities of color. And it's important for us to recognize how economics has impacted the community at large as well. One area is the multi-generational family households were greatly impacted by COVID-19. They may have had an essential worker who needed to go out and work, and then they would come home to the grandparents, to children, to grandchildren. And many times that these multi-generational homes ended up with the entire family infected with COVID and having issues with social distancing, getting medical care, getting connected to services. In addition to that, we had a loss of jobs when we shut down for the pandemic. Many people who needed to work was unable to work. And that loss of jobs also led to housing issues. Individuals were unable to pay their rent. They were unable to pay their mortgage. And then as a snowball effect, it also impacted food. We had food insecurities across the country. Many people were standing in line to get food support, to get food stamps, and to access food. And some people are still having issues with that. Approximately 25% of the population is still having issues with food insecurity presently. Finally, in regards to education and our students, we know that our students prosper when they're in school with face-to-face learning. But with the shutdown, many of our students had to go virtual. And with virtual classes, they either had poor or no Wi-Fi support. They had reduced the learning time, and that impacted their achievement levels. So we're happy that they're back in school, but we need to make sure that our children are safe and encourage our parents to make sure if their children between 12 and 18 can get the vaccine, to encourage them to get the vaccine and to be safe. Next slide, please. So the faith community has been very active during this COVID outbreak and this pandemic. Many of the churches and local agencies have had vaccination clinics. They've had testing sites. Arlington Church of God, the House of the Lord, City of Joy, as well as Mount Calvary Baptist Church and other churches have provided vaccination clinics as well as testing sites. In addition, Pastor Derek Willis, he's the senior pastor of People's Baptist Church. He was able to connect over 600 people to the Summit County Health Department to receive vaccinations. Just his cell phone and just his connection within the entire community, he was able to do that in his congregation. In addition, many of the churches have food banks. They volunteered at the Akron Canton Food Bank to supply foods for the general public. The Mount Calvary Women's Ministry also provided a food opportunity for the community to receive food baskets. The Farmers to Families, Akron Masonic Prince Hall, they also provided 150 baskets to the surrounding community in the 44307 zip code. So that's very important to make sure that our children are sufficiently fed. Many of the parishioners in the area churches have volunteered to distribute food from the local schools when the schools were closed, because the schools provided lunch for the children and dinner for the children as well. Finally, many of the members have also are members who are sewing and very efficient with sewing. They provided face masks for Children's Hospital. And in addition to that, Cleveland Clinic, Akron General had distributed care packages for senior citizens, and local and area churches were able to distribute several hundred of these gift packets to the senior citizens with health information about COVID-19, water, face mask, and hand sanitizer. So those were other areas that the local churches participated in. So when we're talking about the Mount Calvary nurses, we've been around for a long time, and our pastor and our goal is to support our community. And as a faith entity, we know that it is our role to make a difference in the lives of our community. We are committed to Christ, and we are also committed to the community. And in doing so, when we recognize that there are health disparities or issues that impact our community, our nurses ministry will step up and provide support to the community, as well as bring resources into the community to improve the health of our membership, the congregation, as well as the community at large. So next slide, please. So COVID-19 updates. COVID-19 hit us in March of 2020. And recognizing that COVID-19 would more than likely be a pandemic and impact the community at large, our nurses ministry started updates with our congregation and the community. With these updates, we provided statistical information to our congregation. We provided health information about COVID-19, how to protect themselves when they're out in the community, how to access services that they may need. And in addition to that, we also connected them to the health department, to the local hospitals in the area if they became ill. In addition, we had 3 components to our updates. We had the nurses who provided health information to the community and to our congregation. We also had someone from Akron City government that also provided information. And thirdly, because we know that our students are important, we wanted to make sure that we knew what was going on in the Akron Public Schools, where we could assist our students and provide help to our students to access either Wi-Fi or food resources at the end of the day. In addition to that, the ministry is connected to local hospitals in the area. We're connected to the local health department where we work with them and connect individuals to services as well. So next slide, please. Okay, mental health. I won't go into a lot of mental health because I know Bishop Johnson will be talking about grief and the mental health component. But we recognize that as the numbers of COVID-19 increased, many people's anxiety also increased as well. We also recognize that young people, people of color, adults, children, as well as essential workers were disproportionately affected by anxiety and depression. And in addition to that, suicidal thoughts and stress-related mental health issues increased during that time. So the overall population, 4 in 10 adults experienced anxiety and depression during this COVID pandemic. So recognizing that, we felt that it was important for us to provide support not only to the community with Minority Behavioral Health Group, which is a mental health counseling agency, but also internally, we have provided support for our congregation as well. We have a mental health counselor, actually several mental health counselors in our church. And what we've done, we have the mental health moment during our services and during our Sunday school classes. So what we basically do, our counselor, she coordinates our Sunday school lesson along with mental health, the mental health component. We discuss stress, how to handle stress, how to deal with emotions. We talk about nurturing each other and having a sisterhood. It's important that we know that we have support from our sisters, whether through phone calls, through the mail, we have activities via Zoom so that we can stay connected as well. And then we make phone calls to one another to make sure that we're connected. Some of our ladies have also gone to the park and socially distanced and had a socially distanced picnic to make sure that we stay connected with our congregation. So lastly, in regards to mental health, we have to bring hope and we have to be hopeful. And as believers in Jesus Christ, we know that it's important that hope and knowing that we have that belief in Jesus Christ, that we have to have that positive belief system and have that foundation in regards to prayer, supporting one another, and making sure that everyone receives the support that they need. Okay, next slide. So we need to encourage each other and build each other up. And that's from 1 Thessalonians 5:11. So I'm sure just hearing the presentation about what the community does and how you reach out to your participants. And actually Mount Calvary has reached out to your agency as well and gotten services for some of our membership and some of the members, individuals in the community. Next slide. So also community education is important. We were able to reach out to the National Institute of Health, and we had Dr. Glenn Simmons, Jr., who is from the National Institute of Health, as I said, to do a community forum on COVID-19. He addressed the brief issue of health disparities, as well as the mistrust of the medical community in regards to hesitancy of getting the vaccine. He also discussed the immune system and how vaccines work. And in addition to that, so that the congregation and the visitors on the Zoom meeting could understand why it's important to get the vaccine, he also discussed how clinical trials originated, how they are developed, and how the vaccines are developed as well, as a way to educate our community and to make sure they are aware that the vaccines are safe, that they are effective, and this isn't a vaccine that just all of a sudden appeared. This has been going on for many years. The science behind the RNA has been going on for many years. Next slide, please. So the faith community planning for the future. We always have to plan for the future. We always have to make sure that our congregation and the community is ready for whatever may come, whatever may happen in the future. So we have to prepare our facility, our HVAC system, our heating, ventilation and air conditioning system to make sure it's functioning well. We have to make sure that we have our supplies available. And in addition, we have to make sure we're addressing spacing. In addition, as a church and as a community, our children have, during this pandemic, their access to vaccinations have decreased, and it's important for our children to make sure that they have become up to date with their vaccines. In addition, we need to make sure that we educate our congregation on the influenza vaccine, because we know that we're heading into the influenza vaccine season. And it's important for our senior citizens and those who are at risk to receive the influenza vaccine. It's also important to have a contingency plan to pivot from face-to-face services to virtual services. And many churches or several churches are going into face-to-face services now, but they also need a contingency plan to pivot back to virtual services so that our congregation and the community can be connected. Finally, continued collaboration with our local health departments, with our local hospitals, collaborating with our local churches as well is very important so that we can stay connected as a family and as a community in Christ. Next slide, please. So I talked a little bit about the Delta variant. As you know, the Delta variant is highly transmissible. It's the variant that was found in India. And this variant can cause more than 2 times the infection as the original variant for COVID-19. It is across the United States, as well as causing a pandemic of unvaccinated persons. Unvaccinated persons are at high risk of getting the Delta variant of COVID-19. So it's important for us to encourage individuals, if at all possible, to get vaccinated. And we understand that some people are still hesitant about getting the vaccine, but we also need to encourage them and let them know that the vaccine is effective, that it does reduce hospitalizations, it does decrease severe infections, and it also reduces the number of deaths of persons who are vaccinated. So if you know of someone who's hesitant, I encourage you to encourage them to talk to their healthcare provider, to talk to their clergy in regards to how they feel about the vaccine, and encourage them to get the vaccine if at all possible. In addition, the 5 to 11-year-olds, the Pfizer vaccine is becoming available for those children. So please encourage your participants to talk to their physicians and talk to their healthcare providers about their children receiving that vaccine as well. Next slide, please. So there are several community resources that's available. Of course, the Summit County Health Department and our local hospital systems are available for resources and accessing services. The Akron Canton Food Bank to address food insecurity. They have a website and you can call them, and they have several locations where your participants can access food sources. Grief counseling, there is a grief group that will be held every Tuesday at 6:30 p.m. from September 14th to November 2nd at Mount Calvary Baptist Church. And you can just register by calling 330-374-1199. In addition, for individuals with mental health concerns or suicidal ideations or suicidal thoughts, what you can do is have them call the National Suicide Prevention Hotline, and they can connect them to services as well. Finally, there's a COVID crisis hotline that's open 24/7. They can connect individuals to services such as family services, food resources, employment opportunities, physicians, etc. And other resources that's available are your CDC, the Centers for Disease Control, your medical centers, the World Health Organization website, the National Institute of Health, as well as the Ohio Department of Health. I'm sure you all are connected to Jobs and Family Services. They have many services available to the community to make sure that our families are healthy, are able to have housing, and as well to have food resources. In addition, if you know of anyone who have passed in regards to COVID-19, there have been resources available to assist in funeral arrangements as well. But I know that was kind of fast, but I wanted to get everything in. Thank you all so much for this opportunity to share. If you have any connections, please let us know, and we can make sure that you all get connected to some of the resources that we have. And in regards, Courtney, can you go back to the grief class, please?
Yes.
Okay, thank you. So that's the resource for the grief class. It's for anyone. The agency also has support for children who's dealing with grief, and Children's Hospital also has a grief support group as well. So that's the information for the support group and grief group that's being held at Mount Calvary from September 14th to November 2nd.
Awesome, thank you. There was another
Okay.
question as well in the chat. Do you have any information on booster vaccines?
Okay, in regards to boosters, presently the individuals who are in cancer treatment, anyone who's taken immunosuppressants or who've had bone marrow transplants, they can receive their third booster shot. Presently, Pfizer is getting emergency permission to have the booster shot for school teachers, people 65 and older, and some people with chronic health conditions. Something came out today from the Centers for Disease Control, and there was some discussion whether to add teachers or to add essential workers. So they're working that out presently. But for sure, the people 65 and older with chronic health conditions and individuals with cancer and individuals who are immunosuppressed can get their third dose presently. You're welcome.
All right, thank you.
Thank you.
Yeah, phenomenal info. Oh gosh, my slides are going funky here. Sorry about that. Phenomenal information, and it's wonderful to see everything that's going on in our own backyards. And with that being said, I will use that as my transition to Bishop Joey Johnson, who's going to speak about grief recovery.
Thanks, Courtney. Appreciate it. Appreciate all that I've heard. And while grief is one of the most off-limits topics in the Western-speaking world, it should be the center of our faith and part and parcel of the work of the church. Why? Because God the Father grieved that he had made people. Jesus, the Son of God, is thoroughly acquainted with grief. And we're warned in the Bible not to offend the Holy Spirit who has sealed us until the day of redemption. Furthermore, the Bible tells us in Matthew 5:4, blessed are those who mourn, for they shall be comforted. And the word translated mourn means to sorrow or lament. Lament is to verbalize grief. There can be no real comfort without grief. Yet, the American church has seldom given any consideration or teaching on grief. This is probably because the language of grief is hidden in the idioms of Hebrew, Aramaic, Greek, and their interpretation. In addition, American Christianity is triumphalistic. It's success-oriented. Consequently, we teach people how to acquire things, but we don't teach people how to lose things. It's very interesting, especially in light of the fact that we all have experienced some type of loss, not only in the distant past, but in the recent past. How many of us have experienced the death of a loved one in the past 5 years? How many of us went to talk to a loved one and found out that they weren't helping us very much? How long did it take before we started to realize that perhaps we just better start acting recovered? Well, we've not even begun to discuss the 42 other potential loss experiences that one can have in a lifetime as identified by the Holmes-Ross stress test. In America, again, we teach people how to acquire things, but we don't teach them what to do when they lose them. And these loss experiences include the death of a loved one, divorce, moving, the loss of a job or career, the loss of health, and one that we don't talk about a lot, the loss of faith in God. This list includes changes in normal patterns of behavior, like obtaining a loan, which also impacts similarly to loss events. In fact, life can be looked at as a series of losses. When we're born, we lose the warm, secure environment of the womb. As we grow, we lose our innocence. When we go to school, we must lose some dependence upon our parents. When we get to school and pass, we lose some of our acquaintances and friends. We get toys and teeth that we eventually lose. We lose pets. We grow older. We lose fitness, stamina, looks, and we lose loved ones. I've been working in this area of grief since about 1982, when a dark night of the soul came to me and caused me to examine the iceberg of my personality. In 2001, one of my members handed me the Grief Recovery Handbook, the action program for moving beyond death, divorce, and other losses by John James and Russell Friedman. And then in 2002, I became a certified grief recovery specialist with the Grief Recovery Institute. Since that time, I've run many programs, helped to establish grief recovery groups at our church, preached about grief recovery, counseled many with grief issues, introduced other churches, started other programs, done any number of workshops, and I've been called the grandfather of grief recovery in Ohio. I'm asking them to make it the father. I don't want to be the grandfather. Immediately, I got excited and I started to work on my own recovery, and the rest is history. The Grief Recovery Handbook is more than a handbook. It is an educational program and a method. And the Grief Recovery Method is a tool to help people recover from loss, one heart at a time. This tool is not found directly in the Bible, but nothing about it is anti-biblical. In fact, the truths and actions are essentially biblical action. Grief is a gift from God given to help us process our pain and our loss. The Grief Recovery Method is a tool. It's a very excellent tool, but it's just a tool. But grief itself is a spiritual discipline that is part of our biblical teaching. It's put forth in the Bible. It's experienced by Jesus. And to procure our salvation, he did that. He went through grief as our example, and mediated by the Father to cleanse and heal our hearts and woo us back to himself, when he will one day wipe away every loss, every pain, every sorrow, every sadness, and every grief in heaven. Grief recovery is a means of facilitating the forgiveness of others. I think you'll find this very fascinating. I believe that grief and forgiveness are either synonymous, or grief and facilitates forgiveness. We urge people in the church to forgive, but we give them no mechanism in order to facilitate that forgiveness. Well, grief recovery is that mechanism. Forgiveness is an attitude, it's a decision, and it's a process. The Bible urges us to forgive or to decide to forgive. However, forgiveness at a deep level requires a process. And the Grief Recovery Method is a mechanism to facilitate what I call deep forgiveness. When relationships end, we always wish that they had been different, better, or more. Forgiveness is giving up the hope of a different or a better yesterday. Before we talk a little bit about the Grief Recovery Method, how we use it in our churches and what we do, we had better take a little time to define grief a little more concretely. What is grief? Sometimes we talk about things without defining them. We assume that everybody has the same definition. But grief is the normal, natural reaction to loss of any kind. Grief is not a behavior, but more an emotion. Grief is a complex emotional response to loss. In the Grief Recovery Institute, we use this definition. Grief is the conflicting feelings caused by the end or the change in a familiar pattern of behavior. Grief, to be more practical, is reaching out for someone who has always been there, only to realize when you need them one more time, he or she is no longer there. Now, this is very important. Grief is reaching out for somebody who's never been there, only to realize when you need them one more time, they are still not there. So I'm doing this very rapidly, throwing a lot of information. If I'd have known Courtney was going to control the screen, I'd have given her some slides, but because if I did, we've been in a lot of trouble if I was doing it. But we're ready to answer the question, what is the grief recovery method? The grief recovery method or program is an educational program, the actions of which have proven to help the spirit soar. Many people whose faith has been damaged by an overwhelming loss or by an accumulation of losses over a lifetime have discovered that these actions free their spirit and enhance their relationship with God and with their spiritual principles. I also want to say that I've been doing some reading and some research on the fact that spirituality is a very important coping mechanism for older adults. And so this would be a part of that coping strategy. The Grief Recovery Program is an action program for moving beyond loss, one heart at a time. I hope by listening to me, you can tell that I got a lot of information on grief and a lot of stuff that I like to teach, but that's not today. The Grief Recovery Program is a 6 to 12 week program, depending upon how you want, who the facilitator is and how they want to facilitate it. You can find grief recovery groups in this area, or you can become a certified grief recovery specialist yourself. You can find more at the Grief Recovery Institute at www.grief.net. Here are some books that you need to be aware of. And Courtney, I'm going to send you my presentation today so you'll have it. The Grief Recovery Handbook 20th Anniversary Edition. Read the book, and guess what? You don't even have to wait. You can start doing that work whenever you get ready. I did. When I got my first book, I started looking at it, reading it, doing exercises, and then somebody told me, you can go to a group. Oh, really? Okay, that's nice. But I'm already working because it was so important to me. There's a book called When Children Grieve. Helping children grieve is a very difficult thing, and it often entails the parents grieving along with them. When Children Grieve also helps parents get in touch with their grief feelings, what they really are. The Grief Recovery Handbook helps you to navigate, to process your pain, not as much helping you to identify it. So this would be a good resource. Here's another book, Moving On, Dump Your Relationship Baggage and Make Room for the Love of Your Life. Did I see a lot of hands go up right there? Okay, I want that book. There's a lot of good stuff there. There's the Grief Recovery Handbook for Pet Loss. A lot of people don't know, who don't have pets, that pets are like part of people's families. When they lose a pet, there can be deep grief. And so you need to be aware of that. I've written 2 books on grief. One's called Grief, the Pathway to God, and that is a biblical take on the Grief Recovery Handbook. Church people, often things have to be put in church terms or they can't accept it. And what I did is put it in church terms. And then there is the book, The God Who Grieves. Do you know that the Bible depicts God as a God who grieves, and he grieves all through the Old Testament? And so this book will help you to see that grief is a normal, natural part of life and living. Consequently, grief work is part of the work of the church, even though the church has yet to fully realize that. So that's a brief overview of what the church needs to be doing, what we've been doing. Sister Dancy already told you that's another church that's doing grief recovery work. It's very important. And I want to thank you for the opportunity even to give you this brief introduction to what grief recovery is all about. Thank you, Courtney.
Thank you. That's also very good information to have. And that's one of the reasons why I'm so excited to be doing these meetings, is because there's so much overlap between what we all do and what the community needs. So having these resources and sharing them is really important. Which reminds me, this is, if anyone jumped on after I mentioned it earlier today, this is being recorded and we are going to send it out. But we do have our training coordinator here at Direction Home, Lori Smith, is here to talk to you about our health and wellness programs and different opportunities that may pertain to you regarding those.
Hi, everybody. Thank you for having me here today. I appreciate your time today. I know we're all very busy. We're going to kind of take a spin away from the topics we've been talking about, which are really important. And I'm so glad that both of you are here to share that. That is really great information. Thank you. Thank you. Absolutely. But we're going to talk about some of the health and wellness classes that are available through Direction Home and how you as a faith-based community can also become involved and help your members. So Direction Home offers 5 different health and wellness classes. They are all evidence-based workshops. And what that means is when they were being developed, they were developed by a team of professionals, scientists, medical professionals, and people in the community. And they are data-driven to ensure that by taking and completing these workshops, the outcomes of the people who take them are improved. And they are all led by trained, certified peer educators. And what I mean by peer educators is, though we may have a professional hat, take Carla, for instance, on our staff, she is a nurse by trade, but when she leads these classes with us, she takes that professional hat off and she becomes one of the participants, okay? She doesn't offer that professional advice. It's we're all together as this group learning and growing together. These health and wellness classes are a preventative measure, and the goal of them is to help these older adults in our communities better self-manage any symptoms they may be having from a chronic condition and helping to prevent falls, again, in those older community dwelling adults. And I think one of the most important things to keep in mind is they are absolutely free for participants to attend. There is absolutely no cost to the participants. Next slide, please. The first one that I'd like to talk about is called Chronic Disease Self-Management Program, or Cdsmp, as you will see it referred to. It was developed by Stanford University. And all of these workshops are multi-week workshops. It's not a one session and done. The information does build on itself session to session. And because of that, we do encourage, with all of these workshops that I'm going to talk about here, we do encourage the participants to attend as many of the individual sessions as they can, again, because that information builds and we want them to get the most accurate and thorough information that they can get, again, to best help themselves. So this is a 6-week workshop, and we meet once a week, and each session of the chronic disease self-management is 2.5 hours long. Each participant will get a manual that they can refer to, take home, and if they want to review anything, they've got that information there. There is a little bit of homework to be done, again, not required, but it does just help add to the information that is shared during the class. And it is led by 2 trained certified leaders. And what we do in that class over the course of those 6 weeks is we learn strategies to manage, self-manage those symptoms of any chronic condition that person might be dealing with. So anything from a heart or lung condition to arthritis, to diabetes, to depression, anything like that. And we talk about better nutrition, how to eat well for your body so your body can be in the best condition for it to help manage those symptoms. We talk about having clear and thorough conversations and information sharing with your health practitioners and your family, because we know that family and friends are such a great support system. We want to have that clear communication with them. We talk about stress reduction techniques, and we talk about being physically active, because we know that can obviously help physical conditions. So that is the first of our health and wellness. And then we also have diabetes self-management program, which was also developed by Stanford University. And it is what I'd like to call the baby sister to the chronic disease self-management. It takes those same practices and principles of the chronic disease self-management program and drills it down to look at diabetes, specifically type 2. We do touch on type 1, but it focuses more so on type 2. This again is a 6-week program. We meet once a week for 2.5 hours each session, again, led by 2 trained and certified trainers. And here again, we learn strategies, clear and concise communication with the healthcare team, The nutrition portion is more specific to diabetes, so it takes that food intake into account, how to reduce stress. So all of those techniques drilled down specifically for diabetes type 2. And moving on, this is the first of our falls prevention classes called A Matter of Balance. This was designed by a different organization, but it is, again, a falls prevention workshop. This one is a little bit longer at 8 weeks, and we meet again once a week. And this is a little shorter by session for an hour and a half. Again, we are still using manuals, so we're sitting down discussing things. During these sessions, we do a lot of brainstorming activities. We do that in the other two as well that I mentioned, but a lot of idea sharing going on here. So they want the groups in all these classes to be large enough that there's a lot of idea flow and different points of view, but not so large that somebody's voice feels lost. So this again is led by 2 trained coaches, peer coaches. And what we do here is we learn to be more aware of our surroundings, where our body is in space and how we move, how to be assertive with what we need, not aggressive, but assertive. So if we need help, we are able to ask for that help. And all the while, we are also working on improving balance, strength, and flexibility. And we do start to bring in some exercise forms starting in week 3. And it's nothing like we're not going to go jog around the block. We are not going to go to the local gym and lift weights. All of these movements can be done where the participants are sitting. There are some that we stand up behind our chair and hold on for balance. If they are able, all of the movements and exercises can be modified to be done from a seated position if needed. And then after we learn them in week 3, that's how we open each session. And then we go back and learn those stress reduction techniques and how to ask for help. There is a great assessment for everybody's home that they can take home with them. And as they walk room to room, kind of check a list, make sure that if you have area rugs, they aren't fraying at the edges, and making sure cords aren't laying across pathways, and making sure your stairs and floor spaces are uncluttered. So things like that. And you can just go room to room. It's a great assessment, and people really, really enjoy that class. Our second falls prevention class is Tai Chi Chuan, Moving for Better Balance. And this one, by far, is our longest one. It is a 26-week workshop, and we meet twice a week for 1 hour each session. And this one is the only one out of the classes that we offer that we don't sit down and discuss things so much. This is purely a movement-based class. It is based on Yang style Tai Chi, but all of these forms that were picked, and we do over the course of these 48 sessions, they are modified to focus on people who have an increased risk of falls, older adults who have that increased risk of falls. And they are modified to benefit that population. This is led by a single trained and certified coach. And again, it aims to improve balance, strength, and flexibility. And here again, even though it's a longer workshop, we do encourage folks to attend as many of these sessions as they can, because we do add in what's called mini therapeutic movements, and both the forms and the mini therapeutic movements increase in difficulty and increase that strength as we move along that workshop. And I'm going to share with Courtney, and she can email that out to you, some of the data behind this class in particular, and how much it really does reduce future falls and reduces people's fear of falling. It's pretty incredible at how beneficial that class is. And then finally, our last class that we offer is called Powerful Tools for Caregivers, or PTC, as you'll see that abbreviated. And I believe I saw my co-leader in here that I lead this class with, Teresa. This class, where all of our others are focused on maybe somebody who has a condition, a chronic condition, or a risk for fall, or they have something that they're dealing with like this. This is for those unpaid family caregivers. So maybe you are a daughter or a son and you're taking care of your aging parent as well as maybe your own kids. You're in that sandwich generation and you are the caregiver for now your parents, or maybe it's a sibling, or maybe it's a child with special needs. And we understand so much that being a family caregiver, you do it because you love that person and you want to do it for that person. But it can be incredibly stressful. Financially, mentally, physically, it can be very stressful, and we know that. So throughout this 6-week workshop, and here again, we meet once a week for an hour and a half each session, we discuss some of the difficult emotions that we can feel as that family caregiver. Sometimes guilt can come into play, guilt that we maybe feel we've lost the life we had and now our time isn't where we maybe want to spend it all the time. And that's normal, that's natural. Maybe even some resentment, not towards that person, but to the situation everybody is in now. Maybe there's some friction in your other relationships, and those feelings are valid, they're okay, they're normal, they're natural. And we talk about how to work with those emotions and how you as a family caregiver can reduce stress. We know you already feel strapped for time. So how in the world am I going to incorporate stress reduction techniques? We talk about that, and those techniques are out there, and we help bring them to you and how you can work them into your daily life. We let you know that you're not alone in this. We have a plethora of other resources that we can share and help give to you to help you be the best you can be, so you can also be that fantastic caregiver. This is, again, led by 2 trained and certified leaders. And it's a great reminder to me. Every time I lead this class, Teresa and I always look at each other. It's like, that is a great reminder for us too. So I appreciate leading this class every single time I do it. But I think the most exciting thing I wanted to share with you is we are looking for both host sites and leaders to lead all of these workshops. Typically, these classes are done in person. Right now, with COVID, as we've heard from both of our previous speakers, we want to make sure that people who attend these classes are staying healthy. So that is our first concern. So we are doing all these virtually at the moment. I typically use Zoom, but if you have another favorite format and platform, that is absolutely fine. But when we look for host sites and leaders, these are the benefits to those sites and leaders. If you contract with us to become a host site, you would receive $25 just for the use of your space. And that is for most of those classes, anything from the chronic disease, self-management, to the powerful tools. Now, the one that is longest, if you choose to do Tai Chi Chuan, that of course is a much longer program. So there is a little bit more dollars available to you for that one. And in addition to that $25 for the use of your space, for each participant who attends those workshops and completes a workshop, and that is attending the majority of the classes, and it's a little bit different for each workshop. For each person who is a completer of that workshop, you would receive an additional $25. And that is free for you to use however you like. If you've got another program that you are trying to fund and you're just not quite there, you can use it for that. Anything you'd like, however you want to use that. Leaders, should you decide to become a leader with one of these programs, leaders receive $25 for each session that they lead. And of course, in becoming trained, Direction Home would cover all the costs of training for that. So if anybody would like to talk further about that, what the space would look like, because it does need space. Again, right now we're in a virtual world. I can help you with transitioning in that direction if you would like, or if you are interested in using that physical space, please let me know. I think the next slide has my contact information. You can get a hold of me anytime, and I'd be happy to go deeper with you into those details about either becoming a host site or getting some of your members or people on your staff trained as leaders. That's a great way to work it, especially being in the faith-based community. You kind of have a self-populating model there. If some of your staff or your members are interested in becoming leaders and talking to your congregations about participating, and their friends and their family. It's kind of a self-populating thing, and it's a great, great model. But there is my contact information. I would love to talk with you further about getting that in the works. But in the meantime, any other questions I can answer, or any questions at all I can answer? Mine was short and sweet. All right, thank you for your time. I appreciate each one of you.
Thank you, Lori. All right, here is our contact information for the Direction Home staff you heard from today. I am on there as well. And then also our next meeting is going to be on December 17th. That'll be our next quarterly faith community meeting. So more information will be coming out about that closer to the date. But for now, there is the date for you to save. I hope that all of you can make it. I'm very grateful that you took the time out of your day today to join us. Some really good information. And of course, thank you to our speakers. They did a wonderful job. I'm very excited about all the possible partnerships and ways we can work together moving forward. So I think this is going to be a really good group to keep up with and attend. But if you have any questions, feel free to reach out to any of us. This meeting is recorded, so I'll be uploading it to our YouTube and sending that link out, as well as the slides and any other information that my speakers today would like me to include in that email. And we will see you soon. Thank you.
Thank you, everybody.